All right, guys, so we're here in Clinton, Maryland, off of Piscataway Road. We're at the Fibroid Imaging Center. Today, I will be interviewing my fibroid expert, Dr. Nordine Gaugau. We'll be talking about fibroids, the complications, symptoms that people deal with, and we'll also be talking about the procedure I will be undergoing and other procedures that people undergo as well. So hopefully this interview will help to answer questions for those of you who might have questions and have been having a hard time getting them answered. So tune in. I hope it blesses someone, but we gotta go. Let's go. All right, guys, so I'm here with Dr. Nordine Gaugau. He's located in Clinton, Maryland. He is a fibroid expert, and he is my doctor that I'm going to for my UFE, Uterine Fibroid Embolization. Today, he's going to be answering questions in regards to the procedure, but also symptoms and what exactly fibroids are. So my hope is to answer anyone's questions that you might be having or you feel like others haven't been able to answer for you. So tune in, and I hope this interview can serve a purpose in your life. All right, Dr. Gaugau.
Hello, Monique.
How are you doing
Good,
today?
how are you?
I'm great. Thank you for taking the time to do this interview with me. I greatly appreciate it. This is my first time interviewing a doctor or really doing an interview with anyone. So
wonderful.
I might have some humps and bumps, but work with me.
No, you'll be fine.
Thank you.
Don't worry about it.
So my first question that I want to ask is, so what exactly are uterine fibroids? And where do they come from?
Yeah, so uterine fibroids basically are benign tumors that arise from the uterus.
Okay.
Obviously, everybody knows the uterus is the reproductive organ, and it is formed with smooth muscle fibers and smooth muscle cells. Those muscle cells can turn into benign tumors called uterine fibroids. Those fibroids, they can grow out of control, even though they grow slowly, but they can grow to a size where it becomes bothersome, and they can at the same time cause a lot of symptoms.
Okay. Yeah.
We can talk about the symptoms as we go, but they can be quite debilitating, and so they tend to affect most women during their lifetime, but then thankfully only about 25 to 30% of the women with fibroids will actually experience symptoms that require some treatment.
Who is more prone to getting fibroids? Is there a certain ethnic group?
Yeah, it's a great question. Most women, like I said, about 80% of women will at some point have a fibroid, but about 25 to 30% will have the symptoms that require, intervention. We noticed that the uterine fibroids are more common in African Americans.
Okay.
They're also prevalent in Caucasians, but not to the same extent. Asian background, ethnic background from Asia, they tend to have the least incidence of uterine fibroids. Now, nobody knows why they are prevalent in certain, ethnic background versus another. Theories are, out there about genes. There may be something genetic, going on. I'm aware of some studies that were done by the National Institute of Health where they found, a few genes that could potentially explain why, fibroids arise in certain population. The good news, though, is regardless of the incidence or the ethnic background, these are all 100% benign tumors, and they can be tackled, effectively.
Okay. So what symptoms should a woman look for when she has uterine fibroids? Will everyone's be the same? Will it be different? Is it dependent upon certain things?
There are a few, uterine fibroids can cause a lot of symptoms. And sometimes those symptoms, they don't look like they're related. Yeah. But some symptoms, they tend to be more common. Heavy bleeding is one symptoms we see a lot. Pelvic pain, especially during the period. Urinary frequency, urinary incontinence, a lot of bloating, constipation. Sometimes you may not have any symptoms, but then you just notice that the abdomen is getting larger and larger, and sometimes patients will even tell you that they actually, when they're laying down or sitting down, they might feel that there's some mass or some tumor under the skin. Sometimes it can affect intimacy, painful intercourse. Sometimes it may cause symptoms that may be related to other systems like musculoskeletal systems, back pain, can be, perineal pain. Patients get headaches, they get like hemorrhoids, stuff that can not be thought of as related to fibroids. So it's a multitude of symptoms, but in most cases, patients will come to us with heavy menstrual cycle. Sometimes they bleed even between periods, and severe pelvic pain and urinary frequency. These tend to be the most common ones.
Next is how fibroids affect your professional, social, and personal life.
What would you say when people come to you? How do they talk about how fibroids affect their personal, social, just their lifestyle in general?
Yes, definitely the quality of life is extremely affected by symptomatic uterine fibroids. Bleeding obviously, will cause a lot of discomfort, will cause a lot of, pain. And you can't go to work because you're having a lot of pain, because you're having a lot of bleeding. You have to change, all the time. It affects people at the personal level, like in their intimacy and everyday activities. Professionally also, a lot of women tend to take time off just because they have those severe symptoms. So really, symptomatic fibroids can cause a lot of, decrease in quality of life. And they can make, somebody's life miserable.
I know for myself, I'm fatigued. Like, my energy levels are shot. I deal with the back pain, the abdominal pain. I've had them for a long time, but it's just this past year it's been crazy, and I've never experienced the symptoms to the extent that I have them now. So I'm just like, wow.
And because the symptoms can be so variable, sometimes, you may be confused to what's going on. Really.
So for me, I have PCOS as well. So I originally thought it was due to my PCOS and was trying to treat that until I actually got the MRI and was like, wow, no, it's these fibroids that are causing the issues, not just the hormonal imbalance of PCOS.
Correct. And patients can have fibroids for a long time, and they can deal with symptoms for a long time, but they never realize that it's due to the fibroids. And if their healthcare professional does not point it out,
and mine didn't until I met you.
It can go unnoticed for a long period of time.
I can vouch for that. That definitely happened for me. I was dealing with a lot of different symptoms, and my doctor would be like, "Oh, this is okay." And originally, I was told they were small. It wasn't until we did our MRI. And we saw everything that I was like, wow, I was shocked because my doctor was like, oh, don't worry about it. Everybody has them. He was like, my leg pain is not connected to that. There's no way. And I was just like,
it's like we said earlier, these symptoms can come with variable, so many symptoms. And sometimes, you may end up being sent to orthopedic surgeon because of back pain. You may be sent for an ultrasound for your legs, thinking that you may have a blood clot just because you have pain. So it's very important that if you do have those kind of symptoms, to seek help. And get the proper workup so you can get the proper treatment too.
I totally agree. Feeding off of that, how should a woman with fibroids proceed to get help? Because I can say for myself, sometimes seeking another doctor is hard, especially when you've been committed to one for so long. How do you break that mold and get out of your own way and go seek help or seek advice from another expert?
So, most of the time, patients will first talk to their primary care physician about certain symptoms. Hey, I have heavy bleeding, I have this pelvic pain with my cycle, I have like this urinary, frequency or incontinence. And, most of the time, it may end up being treated as an isolated symptom, and so nobody pays attention that the patient actually may have fibroids. You know? But if the complaint is recurrent, as it happens all the time, then probably whoever the healthcare professional, whether the primary care physician or the gynecologist, should initiate some sort of workup just to figure out what's the explanation for these recurring symptoms.
Okay.
You know, so talk to your primary care physician about these kind of things, because the symptom may or may not be, you know, related to the fibroid. When you go see your gynecologist, they should be able to diagnose you if you do have fibroids, because they're familiar with the, you know, the symptoms, you know, especially the bleeding, the pain, and the urinary frequency. But at the same time, there's another type of fibroid specialist, which is us, the interventional radiologists, and we do have really good expertise when it comes to dealing with fibroids, and we can manage them from A to Z, basically. If you know, a patient decides to go see whether the primary care physician or the gynecologist or the interventional radiologist, they need to advocate for themselves. They need to be able to ask all the questions. Do not hesitate. And if you're not satisfied with answers, if you're not satisfied where your management of your symptoms or your case is going, then definitely seek a second opinion.
Right.
You know, you may as well just go see all three specialists, see the primary care physician, the gynecologist, and the interventional radiologist, and see where you get most comprehensive approach to your problem.
So when you go seek help, what diagnostic work is needed to confirm that you have these fibroids?
Yeah, so like we said earlier, talking about the you know, the symptoms and how you should proceed. You know, the most common case scenario would be, you know, a patient, a woman that has all these symptoms or part of these symptoms, some of these symptoms, and they should get an ultrasound to begin with, just so we can have an idea of what's going on. Are these symptoms related to the uterus or to the ovaries or the pelvis in general, or are they due to something else? Once the ultrasound is done, if it shows that you have fibroids or you have, you know, adenomyosis or endometriosis or any, you know, thing that could explain the symptoms that you have, then you can base the rest of the workup on that. You know, or if there's still a question mark and we're unable to figure out from the ultrasound what's going on, then the next step should be an MRI. An MRI is actually more accurate and more productive in terms of figuring out what's going on. And even it helps you come up with, you know, treatment options for the patients. Because the contrast and the resolution for MRI is unsurpassed, you know. But it remains like a little bit of an expensive test. So ultrasound, start with the ultrasound, and if there's still a question mark, move to the MRI. The most important part, though, is that if you decide to go for a treatment, whatever treatment you choose or you opt for, make sure it's based on an MRI and not an ultrasound. It's very, very important. With the ultrasound, you know, it's a good test, it's cheap, it's helpful, but sometimes doesn't tell the whole story.
We saw that with when we did my MRI, because the ultrasound didn't show everything like what your MRI.
If you're gonna proceed with the treatment with management, you know, it's extremely imperative that you do it based on an MRI and not an ultrasound. At least that's my experience, and that's how we got, you know, very successful, you know, practice.
From my experience with you, I definitely would agree with that. I appreciate that very much. When it comes to treatment, what are the different options?
So the good thing today is patients do have a lot of options available to them. Obviously, years back, you know, decades ago, you either had to have a hysterectomy, or you had to have a myomectomy, or you had to deal with your symptoms. You know, even the medications decades ago was not that effective. Over time, the medications became more effective. So you have the, I mean, we can categorize the treatments in three basically sets. So set number one would be medical treatment.
Okay.
Medical treatment, which will, encompass the, birth control pills, the implantables. It would IUDs. They tend to be very helpful. Sometimes, injections can also be, helpful. If you want to move into more involved treatments, so you have the traditional surgery, which is the hysterectomy and the myomectomy. The hysterectomy obviously is the removal of the uterus, and the myomectomy is you leave the uterus in place, but you remove the fibroids. Okay. Now, these two procedures, they tend to be very invasive, and they tend to require a lot of recovery time, and they tend to come with, many complications. So the third set of treatment is what is, the iPhone version of these two procedures, basically. it's which is the embolization. It is called uterine artery embolization, but it is also called uterine fibroid embolization, or most commonly people know it by the UFE,
right?
Sort of abbreviation. So the embolization basically is the most technologically advanced. It's minimally invasive, and in fact, you hear about laparoscopy and about robotics and all that.
Yeah.
But the only real minimally invasive treatment is the embolization, because it doesn't require any cutting, doesn't require anything, and it uses very technologically advanced catheters and treatment options. So which treatment do you go for? That's something you're going to have to work up with your physician.
Okay.
But if you can find, for example, a practice or clinic or a hospital or a healthcare professional that can manage your fibroids and your symptomatic fibroids or adenomyosis or whatever, causing those issues, from beginning to end, from A to Z, that's the way to go.
Okay.
Because you need a comprehensive approach.
Right.
Personally, and in our practice, we favor the uterine artery embolization because it's very safe. It's a permanent treatment. It's very quick, and it's an outpatient procedure. It's very cost effective, and there's no significant downtime. And patients, because the majority of our patients are young, active professionals, so they don't want to be out for a long period of time.
Yeah.
Embolization gets them back, to work symptom-free in a record time. But at the same time, we still work with our gynecologists, we still work with primary care physicians to try to give the patient the maximum attention, possible, so they can get the best care possible.
Right.
But in general, I would suggest, in fact, that every patient should explore the UFE before they explore any other treatments.
So, a big question for someone, I don't have children yet, right? And for anyone, women, I know they deal with fibroids at different stages. Some,
Correct.
like I was diagnosed when I was 16 with fibroids. They were perfect. They didn't bother me in my 20s, but here I am in my early 30s. Not yet a mom. I have some friends that are moms. They've had fibroids and they went through the process of, getting them removed and things like that. How does the UFE affect fertility?
Oh, that's a very good question, actually. And if you look on our website, you'll see plenty of articles dedicated to just that subject.
Okay.
But in general, the embolization does not prevent you from getting pregnant. And pregnancy is certainly possible after embolization. In fact, we have so many patients that went through our practice, get the embolization, and they gotten pregnant, did not affect their fertility.
I saw your reviews.
Yeah. And they have kids that are healthy, So we're not worried, about that part.
Okay.
Before, a long time ago, when research was still ongoing, in its early stages about the embolization, it was only, ethical and, natural to sort of offer this procedure to patients who have completed families,
Okay.
because we didn't have enough data on, you know, how it affected fertility,
Right.
etc. But over time, it became clear that actually it can help you. It can facilitate getting pregnant.
Oh, wow.
There was even, like, you know, a large study that was done and published in 2017 where the title says actually UFE restores fertility.
Oh, wow.
You know, which was like, you know, something like that. That
Okay.
UFE may actually restore fertility.
Okay.
It was an amazing, you know, study. And a lot of authors around, you know, the globe have reported that they have patients that have gotten pregnant. So certainly in our practice, we do have a lot of patients who have gotten pregnant. So we know for a fact, you know, it doesn't affect fertility in such a negative way that was described before.
Right.
But at the same time, it's always good to know that for every patient should know this.
Right.
Each time you perform a surgery, regardless of what it is,
Right.
on a certain organ, it's most of the time not going to be like the original.
Right.
You know?
That makes sense.
So there's always going to be, you know, in terms of, like, you know, pregnancy, for example, with the UFE, whether you do the myomectomy, whether you do the embolization, or whether you do any other, you know, type of, you know, except for hysterectomy, obviously, you can't get pregnant after hysterectomy.
Right.
There will be some sequelae. There will be, you know, for example, you get a UFE or you get a myomectomy, your risk of miscarriage is going to be higher than somebody who never had,
Right.
you know, that procedure.
Right.
So you have to have some degree of risk tolerance.
Right.
You know, should I get the embolization? Should I get the myomectomy? Obviously, your healthcare professional is going to have to work with you in figuring out what's the best option. But some degree of risk tolerance should be there. I mean, we talked the other day, similar to, you know, if I drive on the highway, would I have an accident?
Right.
You know, something like that. Sometimes, you know, and this is very legitimate, like, you know, we do have patients that do not want to talk about conventional surgery.
I was one of those.
Yeah.
I was.
They do not, which is very understandable. So if you have a young patient, right, that doesn't have kids yet, but does have all these symptoms, all these fibroids, and is miserable as it is,
Right.
but does not want to have conventional surgery, what are you going to do? You're going to abandon them? You have to offer them something.
Yeah, you do.
And the embolization is an extremely good procedure for those cases. Yeah. So certainly, you know, we do offer it to patients and women in childbearing age.
Okay.
Yeah.
All right. So something that I'm curious to know, what are the side effects of the uterine artery embolization?
Yeah. So, like any other procedure, you know, whether it's minimally invasive or not, it's going to have, you know, there are some universal, you know, side effects, bleeding, infection, but because we perform these in a very controlled environment, the likelihood of that happening is almost zero.
Okay.
And certainly in our practice, we never had anybody who had major bleeding or had any serious infection.
Okay.
Yeah. So that's one thing. The second thing, of all the procedures that you may consider for the fibroids, whether it's hysterectomy, the myomectomy, the ablation, or the embolization, the UFE, the uterine artery embolization, or aka the uterine fibroid embolization, has the lowest risk profile.
Oh, wow.
You know, it has the lowest risk profile. Why? Because it utilizes very technologically advanced approach,
Okay.
very tiny access site, very tiny, you know, well done, you know, equipment. It's a same day, and the recovery time is very short. So the likelihood of developing, for example, blood clots in your legs, that would happen, for example, in a hospital setting when you had conventional long surgery.
Yeah.
We've never seen that happen, you know, even though we take all the precautions, we've never seen that happen.
Right. And that's good.
Yeah, you never see somebody have an embolization in an outpatient basis and have pneumonia after that. You never see anybody have, you know, the embolization and then come up with some major sepsis or something that is life-threatening. So really, in that regard, it's almost a procedure when it's done the right way and it's done by experienced, you know, operators, is almost devoid of complications. But again, just keep in mind, any procedure
there's risk.
Has some risk,
Right.
you know, and so patient selection, you know, is very important.
Right.
Yeah.
I got you. And basically telling someone that this is for you and this is not for you.
Correct.
Right?
Yeah.
I
Yeah.
got
And that's why, like, you know, in our practice, virtually we've never had any major complications.
And that's good.
Never.
That's great.
Yeah.
That's why I'm here. Me being a woman with fibroids, should I consider, or anyone else, should UFE be considered for any other before any other treatment?
It's a very good question. I think, though, personally, and from my experience and the results we've got over the years, it is my belief that anybody, any woman with symptomatic fibroid should consider embolization as a first option before considering any other treatment. Very, very important. Why? Because it's a definitive, minimally invasive treatment. You know, you can get the same results you can get with major surgeries without having to undergo through all the side effects of major surgery. So, and it's also fair, it's also you know, only fair to patients that they be presented with the embolization as an option of their treatment.
Okay.
Do not listen to somebody that offers you major treatments without you know, mentioning the embolization.
Giving you the option.
Very important.
Okay.
It's very important. Everyone has the right to figure out or explore whether they would get better with as minimal a surgery as possible before they consider anything very invasive.
Okay.
And so I would put embolization as top of the list, first option, and the more invasive options as, you know, when you've exhausted everything. Then, or, you know, the invasive surgery has its place, for example, in patients who have cancer.
Okay.
Anybody that is found, like, you know, they think they have fibroids, but they're found to have cervical cancer, or they're found to have uterine cancer or ovarian cancer, then obviously, you know, you have to go for the more invasive, like, because you want to excise as much as you can of the malignancy.
Right.
You know. But for fibroids, I would discuss embolization, UFE, before discussing any other
Does
treatment.
size matter when it comes to the UFE?
No, not really, because, you know, and this is where, you know, our practice, you know, is great. Is we work in tandem with the, you know, the gynecologists, the primary care physicians, and all that, and we collaborate.
Okay.
So when we have cases, we discuss them, when we share opinions, and we come up with the best treatment possible.
Okay.
So if you have somebody with big size fibroids, we don't turn them away.
Right.
We still can do the embolization, and then a lot of other factors will play in, whether we need to do extra work, extra procedures, extra treatment, or we should just observe them, etc. So it's complex, and that's a subject apart that we can talk about it, but the bottom line is that there's no limit in size, really. At least in our practice, we tackle all the types of fibroids.
And that's what people need.
Yeah.
How successful are UFEs in your practice?
So we've been doing this for years and years, and we've done, you know, many cases. And I can tell you, to this day, we've never had a single complications, and our success rate is 99%. You know, we've never had anything, you know, major. We never had any failures. You know, but part of what makes this a very successful procedure is we don't just treat the patient and then release them. Once the patient comes into our practice, they are part of the family, and then we follow up with them. Even when they do better, they do good, and they don't have any more issues, we still talk to them a year later.
That's good.
We still see them a year later, and the door is always open to them if they have any symptoms, they have any issues, to contact us, because these are things, you know, different patients will experience this kind of diseases in different ways. And so that patient doctor and patient practice relationship is extremely important, and that plays a major role in the success, obviously, in addition to you know, the fact that we have very good experience doing this kind of procedures. Yeah, so I can say it's very successful.
So it's like you come into a village.
Yeah, exactly.
They say it takes a village, right?
Exactly, it takes
So
a
there you
village.
go.
That's true.
Everyone needs a good village.
That's true. That's
good
true.
network, a good village. Is
Yeah, it's very
necessary.
important. You know, in addition to just the technical aspect of it, you know, the human touch, you know, the care that you're gonna get.
Right.
We don't just, you know, leave you to yourself to deal with medication, to deal with other specialties. If you need help with other subspecialties, we do that for you.
Right.
We will connect you with other doctors, and we will make sure wherever you're gonna go that you're getting actually the right management, the right treatment. We don't just send you with a piece of paper. We actually, you know, you're part of our practice,
plan,
and then we devise a plan for you, and we do care about you.
Yeah, that's I would say that's hard to find.
Thank you.
I thank you for that.
Thank you.
Going to other practices and experiencing, you know, people being nonchalant or writing you off, or just if you have questions seeming like they didn't want to answer those, that helps with the process, because you really do feel like you're dealing with someone that cares, but also they're an expert in what it is that you do. I can honestly tell that you're passionate about what you do. By the way,
I definitely love it.
yeah. By the way, you know, you talked to me when I first met you. Your staff is amazing, and I'm not just saying that to say I felt welcomed here, and I know I feel like I probably get on y'all nerves, so I'm like always asking questions, but you guys are always open to answer my questions, which is it makes a big difference during this process.
It's important. Look, you know, patients, you know, when you have these kind of symptoms or this kind of pathologies, you know, it's already very distressing.
It is.
And it's already, you know, very big on your shoulders.
It is.
And you want help. You want answers, you know. So we try and provide a comprehensive approach. We don't just tell you, look, you know, we're very good with these catheters, we're very good with, you know, we will take care of you in a comprehensive way, so that way all your questions are answered. And when you leave here, you know you have a plan, and you know you're gonna get better. You know. So,
that's what we need. That's what women
very
need.
good.
So we appreciate that.
Excellent.
This was my interview with Dr. Nordine Gaugau. He is here in Clinton, Maryland, off of Piscataway Road. He is a fibroid expert, great doctor. When I say I came here and I've had almost like an epiphany, like this is where I'm supposed to be. Granted, I'm still nervous as ever. I hope this interview has answered some questions for you guys. If you have more questions, Dr. Nordine Gaugau is located again in Clinton, Maryland, off of Piscataway Road. Do you want to give the address and phone number?
Yeah, so we're located in Clinton.
Okay.
Our practice is called the Image Guided Surgery, the Clinton Fibroid Center.
Okay.
And we're in Clinton, you know, Maryland, and you know, our website is metrofibroidcenter.com. You know, and there's a lot of answers, frequently asked questions, and videos on our website.
Okay.
You know, you're more than welcome to visit that.
His location, email, and phone number will be on the screen for you guys to see. So if us saying it wasn't enough, you'll have it visually, and it also will be in my captions as well. So we hope you guys found this helpful. I hope it blesses someone else that has questions, or maybe that is dealing with this same issue. Or maybe if you know someone, you're not dealing with yourself, but you know someone that has this problem, please share. Not just because I want you to view it, because you can potentially help someone else's life and make it easier. A lot of us suffer with this, and I can tell you for myself, it has been not just physically draining, but emotionally draining. You have your highs, your lows, brain fog, things. It affects so many other areas of your life, and we all deserve to have a great quality of life. So with that being said, like he said earlier on in the interview, don't be afraid to advocate for yourself. That has been like the bottom line for me throughout this whole thing. Advocate for yourself, do your research, and find a good team, a good village that's going to help you get better. You only have one life, you only have one body. Take care of it. And with that, I hope you guys enjoyed. Like, share, save, and thanks for tuning in, guys.